Go.
Come in.
I have already washed my hands, and this is important in order to prevent the spread of germs. I'm Katya. I am your nurse today. I will be performing your head to toe assessment. This will take approximately 10 to 15 minutes. Is that okay?
Yes.
And can I ask you a couple questions?
Yes.
Everything you say will stay confidential. What is your full name?
Hasil Kudoto.
And what's your date of birth?
7596.
And what's today's date?
10/10/2020.
And where are we?
The clinic.
Okay. He is alert and oriented times 4. His facial expressions are appropriate. He is making eye contact with me. How do you feel today?
Good.
His mood is good. His affect is appropriate. His attention span is good. Now I will assess his recent and remote memory by using the 4-word test. So I will tell you 4 words and you have to repeat them to me throughout the assessment. So orange, apple, circle, and house. Can you repeat those?
Orange, apple, house, circle.
Okay. I've already assessed his vitals. His blood pressure was 114/78. His pulse was 75. His respirations were 14. His heartbeat was regular. His temperature was 98.6 Fahrenheit. Are you in any pain today?
No.
Okay. Can you repeat the 4 words?
Orange, apple, house, circle.
Good. So now I will assess his head. His head is normal cephalic. His hair is black and it's evenly distributed. There are no parasites, no lesions. His face is symmetrical. His eyes are in the upper third of his face. His nose is midline. His mouth is in the lower third. Now I will test his cranial nerve number 5, the trigeminal, and you will close your eyes and I will touch your face and you will tell me what I'm touching. I use this cotton ball and I dropped it and I washed it.
My cheek. My cheek. Forehead. Cheek.
Okay? Can you clench your teeth for me several times? Okay? The contraction is strong and equally bilateral. His cranial facial nerve is intact. There's no facial drooping. I'm going to ask you to close your eyes and I will try to open them. And you have to resist to open them. Okay? And now I will assess his nails. His nails are trimmed. They're pink. His capillary fill is less than 3. And I will also check his toes. It's less than 3. Can you repeat the 4 words?
Orange, apple, house, circle.
Okay. Now I will assess his eyes. There's no drainage, no discharge. His eyelashes are everted. They're symmetrical. His eyebrows are brown. They feel coarse. There's no lesions. The way I would test his cranial nerve, the optic cranial nerve would be with the Snellen test, and I would make him stand 20 feet from me. I would take a 3x5 card and I would cover his left eye first and then his right eye and then both eyes. Okay, let's pretend I have dimmed the lights and I will use my pen light to assess his pupils. His pupils are round, equal, and reactive to light. His cranial nerve number 3, which is the oculomotor, is intact. Now I will assess his ears. His ears are symmetrical. The color matches the rest of his body. There are no lesions, no piercings, there's no foreign objects. There's a little bit of cerumen. Do you feel any tenderness? No tenderness. The way I'm going to assess the cranial nerve number 8, which is the vestibula cochlear, will be using a 2-syllable word, and I will cover my mouth and you will cover one of your ears, and then you would tell me what I am saying. Ice cream.
Ice cream.
Okay. Razorback.
Razorback.
Okay, good job. So using an otoscope, I would look at the tympanic membrane and the eardrum and all the small bones inside of the ear. Next, I will assess his nose. His nose is midline. It's not deviated. I'm going to palpate your sinuses. And you tell me, do you feel any tenderness?
No.
Okay. There is no tenderness and on the frontal and maxillary nodes. His cranial nerve number 1 is the olfactory, and we'll test that by you're going to close your eyes and I'm going to give you something to smell. You'll cover one nostril at a time and you tell me what you're smelling. What's
Vanilla. Peppermint.
Okay, now we will move on to his mouth. His lips are symmetrical, they're pink, there are no lesions, there are no cracking. Can you open your mouth? His mucosa is pink and smooth, moist. There's no edema. His teeth, and he go his tonsils are present. There is saliva. His hard palate is white. The smooth palate is pink and soft. His tongue was midline. The cranial nerve number 12 is the hypoglossal, and it's intact. Now I will move on to his neck. Can you hyperextend your neck? And then to the right, and then to the left. So he has a full range of motion in his neck. I'm going to push down and you're going to try to push up. Okay. So the cranial nerve 11 is the accessory and it's intact. Now I will assess his carotid. And his pulses are strong and equally bilateral. Now we'll listen. And take a deep breath. And I did not hear a bruit, and if I would have heard a bruit is an indication of a narrowing artery. Next, I will do his thorax and lungs. There is no tinting of the skin turgor. His color is consistent. You take a deep breath for me. Okay, and then can you do your breast exam. In this one, I would have the patient lay in 3 different positions. I would have them raise their hands at the top, and then I would have them put their hands on their hip, and then I would have them lean forward, and I will be looking for increased vascularity, lesions, dimpling, nipple discharge. I would squeeze the nipple and see if they have any discharges. I would use the vertical strip or a circular pattern, but in this case there is no axillary nodes palpable and no discharge, and a normal breast exam, and that's it.